Good morning, everyone. My name is Dr. Shubashini Gnanasan. I'm a senior lecturer from the Department of Pharmacy Practice, Faculty of Pharmacy, University Technology, Mara. And today I'll be giving a talk on aromatherapy in dementia. So let's begin with the burden of dementia. So globally, every 3 seconds, one new case of dementia will be diagnosed around the world. At this point of time, about 50 million people are living with dementia, and it is expected to triple to 152 million by 2050. With regards to Malaysia, we are projected to increase to 590,000, which is more than 500,000 in 2050. So dementia is actually an umbrella term that covers a variety of different types of dementia, consisting of Alzheimer's, which is the most common, which is about 50 to 75%, followed by vascular dementia, Lewy body dementia, and frontotemporal dementia. Okay, so if you look at the pathological hallmarks of the Alzheimer's disease, if you look at the diagram here, those who have Alzheimer's, they tend to have this neurofibrillary tangles and the amyloid plaques, okay, as well as the hyperphosphorylated tau protein. So these are the markers of the Alzheimer's disease, okay. More than 50% of people living with dementia have behavioral and psychological symptoms of dementia. Yeah? It's quite challenging, especially when your loved ones have apathy, basically do not have any mood to do anything, anxious, having aggressive behavior, feeling depressed, wandering at night, disturbed sleep. So these are the issues that bothers persons with dementia as well as the caregivers, and it can be very challenging, and it becomes worse as the disease progresses. Well, although we do have treatment, pharmacotherapy is available, but it's actually reserved for severe symptoms of PTSD, and it's usually for short-term basis, and it comes with some side effects, which is quite detrimental. So that is why the non-pharmacological intervention or the psychosocial interventions are preferred to be the first-line therapy. So if you look at the diagram here, there are many types of psychological, psychosocial interventions, and aromatherapy is one of it. Okay, aromatherapy is actually an ancient practice where essential oils are used, to improve the mental, spiritual, and physical well-being. It has been used historically more than 2,000 years ago in Egypt, India, China, and many other countries as well. And what is essential oil? So it is actually a mixture of highly complex secondary metabolites which are naturally occurring. And these volatile substances are abundant in the flowers, leaves, seeds, rhizomes, barks, and are usually isolated via the hydrodistillation and cold processing method. All right, if you look at the constituents of the essential oils, the terpenes are the main components, the monoterpenes and the sesquiterpenes. And essential oils, there's a typo there, essential oils are naturally derived antioxidants, and most of them exhibits cholinesterase inhibitory potential, and that is why they're quite relevant in dementia pathogenesis. Okay, so let's look at the route of administration of essential oil in persons with dementia. So in general, there are two major types that is commonly used: olfactory system and skin. Some do ingest, but it's not recommended at all. It could be quite unsafe. So olfactory system is mainly through inhalation using a diffuser. And skin is basically topical applications whereby essential oils are combined in their lotion or in oils and used for massage. Let's look at the mechanism of action of essential oils. Actually, there are two types of mechanisms here that you can talk about. One is the psychological aspect. So how the individual perceives the pleasantness of the smell of the odor of the essential oil, and how is the individual's past association with that particular odor, whether it's pleasant or unpleasant. So these can have a psychological impact on the patient. The other part is the neurochemical effects. Yeah, so unlike the psychological mechanism, the pharmacological mechanism for aromatherapy is not thought to involve any perceived perception of the smell. It is basically due to the compounds entering the body and acting directly on the brain. And this is via the bloodstream and as well the absorption through the lungs and the olfactory mucosa. Okay, so these are the methods through the inhibition of glutamate binding, GABA augmentation, acetylcholine receptor binding. Okay, these are the pharmacological part. Okay, so there are questions here, like people say that people with dementia tend to have anosmia. Okay, because of the early loss of olfactory neurons. But in the case of neurochemical effects, so this doesn't really matter, because if you're not really looking at the psychological aspect or whether they have the ability to smell or not. All right, so it's negligible there. Okay, now only the sense of smell has the direct access to the brain's limbic system. Yeah, okay, aromatherapy works by stimulating the olfactory receptors through the nasal cavity. It connects to the olfactory bulb and then it enters the limbic system, which is usually responsible for the emotional response. Okay, and olfactory sensations can also stimulate implicit memories. Okay, implicit memories are referring to the memories of the past, and that can be attached with an emotional response. Okay, so you can see a diagram here that shows how essential oils affect the nervous system. Okay, it's quite complex, but I have summarized it in the table here, where you can see various essential oils and how they play a role. Okay, like frankincense, ylang-ylang, they have the ability to decrease the glucocorticoid levels, decrease in blood pressure and heart rate, and so on and so forth. Yeah. Okay, so now if we go specifically to aromatherapy and dementia, you can see these are the various type of sources of the essential oil. Yeah? And lavender and lemon balm are the most commonly studied in clinical trials, and followed by the other smaller studies with all the other essential oils lit here. And if you look at the yellow flower, and I'm actually doing a research with my team in the university to look at the effect of diffused ylang-ylang in persons with dementia. So the results will be ready by end of this year, hopefully. Okay, now let's look at the studies on effects of various essential oils. So we have actually conducted a review, and like I mentioned earlier, you can see lavender and lemon balm has been studied in many human studies. And if you can look at the findings, some studies have improvement in behavioral symptoms and some are not. Similar to other essential oils, some studies are positive, some studies have got no significant improvement. And some study used, like Jimbo, his study used more than one type of essential oil, whereby they combined like rosemary, orange, lemon, and lavender. Okay. So last year, the Cochrane review on aromatherapy for dementia was out, and they found that there is no convincing evidence that aromatherapy is beneficial. I do agree with that we need larger studies, but sometimes when we do a systematic review, head-to-head comparisons are a little difficult, yeah, due to the complex nature of the essential oil studies. You know, it's not like drug-to-drug trial, and the compounds in essential oils are very complex, and the methods itself, you know, and you have to take into consideration and of interpatient variation, administration variation, chemical variations. All these things need to be taken into considerations. So before we embark on a larger trials, you really need to do smaller studies first to establish the methods and so on before you actually try in a larger trial. So that's what we are doing at this point of time. We're trying out ylang-ylang in a smaller study and then develop the method. And if it seems to be promising, then we do in a larger group. And then that will be a better source of data. Yeah. Right. So let's look at some of the findings from the earlier studies. If you look at the calming effect of essential oils, lavender, bergamot, and lemon balm can help to suppress aggression, agitation, and other psychotic symptoms. And this study by Jimbo, he actually used mixed essential oils, like you can see here. This study used essential oils from lemon and rosemary that has the ability to activate the sympathetic nervous system, which is believed to help in improving the concentration and memory. And in the evening, they actually used a combination of lavender and orange essential oils, which is believed to have an activation of the parasympathetic nervous system, producing a calming effect. And the study showed improvement in the cognitive function of persons with dementia. Last year, they sort of repeated this study in a mouse model, but they actually explored the brain levels of amyloid beta, the abnormally phosphorylated tau, and the BDNF, the brain-derived neurotrophic factors. They actually exposed the mixture of lemon and rosemary oil at nighttime, as well as mixture of lavender and orange oil in the daytime. It's actually the reverse for the mouse because it's a nocturnal animal. And true enough, this study also supported the benefit in terms of the improvement in cognitive dysfunction. Yeah, and if you looked, the amyloid beta expression and the phosphorylated tau was lower in the treatment group, and the BDNF, it's not significant, but it is marginally increased, which shows positive findings. Overall, it's quite positive that this particular combination does help to improve cognitive dysfunction. Okay, this is also another very small study where they actually gave orange essential oils 3 times in a day, diffused using mist diffuser. It is easy to use. And at night, they gave lavender essential oils, and they found that persons with dementia who are on psychotropic drugs plus essential oils performed better or in terms of reduction in BPSD as compared to those who are on psychotropic drugs alone. Yeah. All right. This is another study, a qualitative study where the nurses reported how their residents, their dementia patients, experience disturbed sleep patterns, and when they tried lavender essential oil, the patient actually slept better, and they also stopped taking their sleeping pills and so on. So this is quite a positive study where lavender seems to be helping patients to sleep better. Right? We conducted a survey to look at the willingness of caregivers to use aromatherapy for persons with dementia in Malaysia, and we found that 35% of the caregivers have tried aromatherapy in persons with dementia, and 83% are willing to try aromatherapy, which indicates that there is a demand. Although it's a very small study, there is a demand. People are looking out for other alternative management to manage BPSD. Yeah? Okay, this is our ongoing study. Like I mentioned earlier, we are studying the effect of diffused ylang-ylang, and we are using the similar behavioral tools that have been studied earlier. But the only different thing with our study here is we are trying to do some blood parameters to uncover the effect on BDNF, hormonal, and antioxidant status in persons. So previous studies have never done any blood investigation, so we're trying to do it here in our study. Okay, so this is the flowchart of our current research where we will contact nursing homes that have patients with dementia, and upon consent, they will be enrolled into a 2-month study, and all those details will be taken. Yeah. Right, now let's look at some of the points to ponder when you want to give aromatherapy in persons with dementia. All right, so you have to take a personalized approach. Yeah, it's very important. Consider whether they are comfortable of being touched if you're considering massage, and even massage with essential oils. It may not be suitable for everyone, especially if they have eczema, psoriasis, allergy, cuts or bruises on the delicate skin. Okay, so try giving the person with dementia with in a tissue, use a tissue, use few drops and see whether they're comfortable with it. So only if they're comfortable, then you can think about embarking on future aromatherapies. And remember, yeah, for persons with dementia as well, some smells may, not everybody do not have the ability to smell. Some do have, yeah. So it can trigger some memories. So if they are unpleasant or depending, if they feel that they're not so comfortable, don't try, or try a different essential oil. And it comes with good practice, yeah. So if they are happy with that particular essential oil, try to do it daily so that you have better response. Okay, and always remember, yeah, or aromatherapy oils are potent. You tend to get carried away sometimes. It smells so good and you want to add more. But sometimes if you overuse, it can cause headache, and people with dementia may have some difficulties in expressing their thoughts, you know, or telling that they don't feel unwell and things like that. So caregivers will have to take notice of all this. And remember the mantra, less is more. Yeah, essential oils, if you, like I said just now, one drop is like 100 times more potent than the plant itself. So you must always consider the safety aspect of aromatherapy, and as well as the storage. Yeah, if you can want to increase the lifespan of the essential oil, probably once open you can store it in the fridge so that it will last a little bit more longer. Keep it away from children. Do not use if the person with dementia is pregnant or so on, especially in the first trimester. And some oils, yeah, have a stimulating effect, okay? For example, like thyme oil, and that can cause agitation. So if you use aromatherapy and you notice some changes, that their behavior seems to be even more worse than before, if they happen to show these kind of symptoms, then maybe aromatherapy is not suitable, or that particular essential oil is not suitable. So you may want to consider change or stop for some time. And if you're using calming oils like lavender and so on, it's best to use it in the evening or towards bedtime. And don't try to experiment with too many different oils together. Try to stick with single oils, or if you know a particular blend works with them, then you can stick to it. If the patients develop side effects, or if, like, for example, there is a rash or they had vomiting and nausea, consider stopping the therapy. Okay, so take-home message here, mostly studied in dementia are lavender and the melissa oil, whereby significant impact was seen, negligible side effects were observed. But there is also a need to explore different types of essential oil and maybe essential oil blend preparation, because one size fits all approach may not really work for everyone. And more evidence are needed through well-designed, large-scale randomized control trials to recommend the use in clinical practice. And the key question is whether these treatments can provide a viable alternative to existing pharmacological agents or as an integrated therapy, and these need to be addressed. Okay, we can always start small and then move on to a larger trial. With that, thank you very much. These are my references. I'm happy to take questions later if there is any.